Hello Mariners, this is Mariners Digest Mohan Das. Today I have uploaded EFA exit exam 50 more questions in set number 2. EFA exit exam questions and answers set number 2. Question 1. The goal of medical service is to provide. Answer. Provide treatment for those in need of urgent medical care. Question 2. What is fainting? Answer. A brief loss of consciousness. Question 3. When you feel fainting, answer. You should sit down with head between knees or lie down. Question 4. How should you pen the airway of an unconscious casualty? Answer. Head tilt and chin lift. Head tilt and chin lift. There is a correction here. It should read open. Correct. Okay. I'll read that question again. How should you open the airway of an unconscious casualty? Head tilt, chin lift. Question 5. When dealing with an unconscious casualty, we should check up to dash for normal breathing. Answer. 10 seconds. Okay. So after opening airway, you will be checking the breathing. Okay, that is you should do only for 10 seconds because your CPR is time critical. You will have to administer CPR once the victim is not breathing within 3 or 4 minutes. Question 6. Before giving CPR, you should make sure. Answer. They are conscious or unconscious. That means CPR will be administered only to unconscious people, not conscious people. That is why you should make sure they are conscious or unconscious. Question number 7. If someone suffers heart attack and has ceased breathing, you should. Answer. Immediately start CPR. Okay. Normally, from the stage of heart attack, they will go into cardiac arrest. Okay. Heart attack is a blockage in heart. Cardiac arrest is total stoppage of function. Right. So, normally you administer CPR after cardiac arrest. But here the question is if someone suffers from heart attack and has ceased breathing. So, once he is not breathing, definitely you should start CPR. Answer is immediately start CPR. Question 8. When a victim is not breathing, answer, close his nose and give 2 air flows on his mouth. So in the CPR, this is what you will have to do first to rescue breath. Then start with 30:2 compression. If you are alone, 15:2. If there are 2 rescuer, 5:1 at the rate of 60 beats. Okay, 30:2, 15:2, 5:1, all are correct. Question number 9. In order to initiate CPR on a drowning victim, answer, begin mouth-to-mouth ventilation, rescue breath. Question number 10. When performing CPR on an adult, how deep the chest compression be? Answer, 2 inches. It is actually 2 to 2.5 inches. So 2 inches is the right answer. Question 11. What damage could occur if first aider's hand is placed on the tip of the sternum during hot compression? So the center of the chest you will keep for giving chest compression. So the tip of the sternum also is there only. Answer is, the ribs might be cracked. Okay, the ribs might be cracked. But what doctors advise, you don't worry about ribs cracking. That can be rectified, okay, later on. But the life is important. So the speed and the depth of a chest compression is very important. 100 to 120 beats per minute, 2 to 2.5 inch depth. These both are important factors in administering CPR. If the ribs are breaking, doesn't matter. That can be treated later on. Question 12. When you see a victim, answer, check the victim carefully for other injury. That is secondary survey. Okay, after primary survey is finished, then you look for any bleeding, burns, broken limbs, etc. Question 13. Inadequate pumping of blood by the heart gives rise to, answer, distributive shock. See, they classified this medical shock into various names. Okay, like inadequate pumping is called the distributive shock. Question 14. The type of shock that is caused by a severe infection is called, answer, septic. Infection, septic shock. Question 15. In a shock, answer, do not give anything to a patient with impaired consciousness. Okay, do not give anything to a patient with impaired consciousness. Question 16. What should you do if you think that the victim has serious internal bleeding? Answer, call for medical assistance as quickly as possible. Medical assistance. You see, internal bleeding, whether you suspect or even if a confirmed internal bleeding, first aider is helpless. Okay, you will have to send him to the hospital. That is why here they say call for medical assistant, not even medical advice, medical assistance. So you need a doctor, or you will have to evacuate the victim to the hospital. Question 17. A wound where there is damage to the soft tissue and blood vessel under the skin is called a bruise. So this is will come under capillary bleeding. Okay. Question 18. What steps would you take to control bleeding from a nosebleed? Nosebleed. Answer. Sit casualty down. Lean forward. This word is important. Lean forward. Pinch soft part of nose. That is the answer. So after pinching the nose, you will have to ask the victim to breathe through the mouth. Okay, for how long? 10 minutes. Because the clotting mechanism in the body takes 10 minutes. Question 19. You discover a particle embedded in the casualty cornea. You should answer. Cover the eye and transport the casualty for medical help. Okay. So any foreign particle embedded in any part of the body during injuries, you should not remove the embedded article. Okay. It should be taken to the hospital. Only in the hospital doctors should remove them. Question 20. What is an open fracture? Answer. A fracture in which the bone is exposed as the skin is broken. So the bone is out of the skin. That is called open fracture. Question 21. To treat a first degree burn, you should answer. Apply cool running water until there is little or no remaining pain. This is the correct answer. Not the 10 minutes, 20 minutes, 30 minutes and all. This is the correct answer for cooling the burn injury. Even first degree, second degree. Okay. As long as the pain remains. So you will have to cool it. Question 22. A burn should be immersed or placed under water for at least dash minutes. Answer 20. Earlier day they used to say 10 minutes, later on 15 minutes. Now 20 minutes they keep saying. Okay, some of the old videos, old books, if you see 10 minutes they say. But if you really, as long as the pain is there, you should immerse them into water. Question 23. Which of the following includes the top layers of skin and involve blistering? So the moment you see the word blistering, obviously it is second degree. Answer. Second degree burn. Okay. First degree burn symptom redness. Second degree burn symptom blistering. Third degree burn symptom charring, black color, white color. The skin changes to black or white. So these are the symptoms: redness, blister, charring. Okay. When caring for someone who is suffering from frostbite, you should not You should not. Answer. Rub vigorously until skin appears red and feels warm. Okay, you should not do that. What is the first aid? You will have to immerse the part where the frost bitten part in the warm water. That is the first aid. Then take him to your hospital. Question 25. What is the first thing you should do for someone you suspect as an electrical burn? Answer. Check to see if electricity is turned off. Here you are suspecting, of an electrical burn. So first you will have to see whether the power supply is still on, whether he is in contact, the victim is in contact with the electricity. So check to see if electricity is still on or turned off. Okay, check to see if electricity is turned off. That is the answer. (26) Why smoking is not allowed for frostbitten effect? Answer. Smoking contracts blood vessel in the skin and slows the healing process. This is the answer. Question number 27. A soft tissue injury resulting from the impact of a blunt object is called answer a contusion. Question 28. You have a casualty that is muttering to themselves but not making any sense. The face appears to be dropping to one side. What might be wrong with them? Answer. They may be having a stroke. Okay. You see in the entire paragraph, face dropping in one side is the important words. First, face dropping one side means it is definitely stroke. That is the symptom of stroke. Face dropping one side. So answer is they may be having stroke. Question 29. Heat stroke attack body's vital organs except answer is bones. Right. Question 30. If a person is choking, you should do nothing as long as answer they are coughing. So if a choking person is coughing, you should encourage them to cough. By coughing, the foreign object which is stuck on the throat will come out. So if they are coughing, you do nothing. You encourage them to cough. Cough severely. Question 31. When performing abdominal thrust, how many thrusts you do? Answer. 6 to 10 thrusts. The medical term for abdominal thrust is Heimlich maneuver. Normally they say 5 times. The abdominal thrust you give 5 times. But in the choice there was 1 to 5 and 6 to 10. So 1 to 5 is not correct. So the answer is 6 to 10 thrust. Okay. Question 32. When caring for a choking infant, what position is the infant held? Answer. Face down on your forearm. with head lower than the body. Okay. Face down on your forearm with head lower than the body. So we are talking about an infant. In medical, 0 to 1 year old, we call them infant. 1 to 7 years, you call them child. Above 7 years, all are adults. So below 1 year, that infant, what you will have to do, face down on your forearm with head lower than the body. For this Heimlich maneuver, for choking, first aid, you can check up with the KG hospital, Dr. Bhaktavachalam. Okay, for adult, child, infant is demonstrating the abdominal thrust, Heimlich maneuver. Question 33. Signs that hernia is serious include: answer, pain and tenderness at sight. Pain and tenderness at sight. Question 34. Which types of pain worsens with the movement? Answer, neuropathic pain. Neuro means nerves. Okay. Any injury caused to the nerve, that will be known as neuropathic pain. So with the movement, they will cause more pain. Question 35. Strain is due to, answer, muscle tearing. That is strain. Usually happens with athletes or gymnasium. Strain, muscle tearing. Question 36. Whether smoking reduces frostbitten effect? Answer, no. Question 37. First degree of burn, you can use salt water. Answer, no. Question 38. In general, you can shift the victim before splinted for the broken bone case. Answer, no. Because any fracture, you will have to splint first before shifting. Okay. Question 39. Tissue make up organs. An organ is a structure performing a particular function. Answer, true. Question 40. To flush an eye that has been exposed to a chemical, have the injured eye lower than the unaffected eye. Answer, true. Okay. Question 41. Heat stroke person should be cooled immediately. Answer, yes. Question 42. Heavy bleeding should be treated by doctor. Answer, yes. Now a few questions where all the above is the correct choice. Okay. Question 43. Symptoms of broken bones are: A. Swelling area, B. dislocated area, C. pain when touched. Answer D. all the above. Question 44. Signs of sprains are A. swelling, B. tenderness, C. discoloration. Answer D. all the above. Question 45. How can you reduce the risk of disease transmission when caring for open bleeding wounds? A. Wash your hands immediately after giving care. B. Avoid direct contact with the blood. C. Use protective barriers such as gloves or plastic wrap. Answer all of the above. D. all of the above. So first aider is advised always use a gloves if available. Question 46. The symptom of shock includes A. low blood pressure, B. rapid shallow breathing, C. rapid weak pulse. Answer D. all the above. Question 47. Question 47. Smoke inhalation requires. Answer doctor advice. Question 48. Burn on the face require. Answer doctor advice. Question 49. Severe allergic reactions require. Answer doctor advice. Question 50. Open chest wounds require. Doctor advice. That is all. 50 questions in this. This is the second set. I will come out with third test set and also fourth set if possible, because EFA has got too many questions. Right? Alright. You read all set 1 and set 2. Give me a feedback out of these 100 questions. How many questions had come in the exam? Or if you remember any new question which is not in this 100, you please tell me in the WhatsApp. I had given WhatsApp number also. This ebook is now available in Amazon Kindle store. It's a ready reckoner for any navigating officer. You can buy it for 100 rupees now. From 210, I slash it down to 100 rupees. Thank you. Bye. Until next video.